Alberta's 17 stroke treatment centres are now among the fastest in the world at giving patients the clot-busting drug TPA. Thanks to a year-long quality improvement initiative, the time between a patient's arrival at the hospital to being diagnosed with stroke and injected with TPA has been halved from about 70 minutes to 36 minutes.
You know, we're here talking about the improvements in acute stroke treatment around the province, and this is based on a collaborative effort between the Quicker Alberta Stroke Program, which is a large program grant funded by Alberta Innovates, and the Strategic Clinical Network Cardiovascular Stroke and Health. And what we're focusing on and have been working hard on is how do we get the acute stroke treatment response better, not only in the tertiary hospitals at University Hospital in Edmonton and Foothills Hospital in Calgary, but also in all of the primary stroke centres around the province.
During an ischemic stroke, in which blood supply to the brain is blocked, about 2 million brain cells die every minute and about 12 kilometres of neural connections are lost. MacNeill was treated for a stroke at Foothills Medical Centre in Calgary.
It was 5 minutes after 3 when it was detected that there was something wrong. And at some point in the Foothills, and I don't remember whether it was before the procedure, after the procedure, or up on the 11th floor after the procedure, but that was 3:30. So it was only 25 minutes round trip.
There are a few areas in medicine where the concept of teamwork is more important. In treating a stroke, precious minutes are saved when team members work in parallel rather than sequentially.
We used a quality improvement methodology called an improvement collaborative, and we worked by learning about the best ways to reduce door-to-needle times. It takes a team, from the paramedics to the registration clerk to the RNs in the emergency department to neurologists, emerge physicians, radiologists, diagnostic imaging technicians. So all of these people have to work together as a team to get a really great door-to-needle time of 30 minutes.
Meaning our emergency physician, our nursing staff, diagnostic imaging for the scanner to be available at that time. And when they do arrive, we do make them an unknown to expedite the scanning process.
So as Sharon said, everybody descends on the patient and
Yes.
we check them out and make sure they're safe and make sure they likely have an acute stroke that needs an acute stroke response. And then we rush over to CT to get imaging done. That becomes important to distinguish if it's a hemorrhagic form of stroke or the much more common ischemic stroke, which is what we can treat. And then we would deliver therapy right in the CT scanner. We give the treatment, if appropriate, in the scanner.
After the clot came out, then the right side of the brain was getting the blood it needed again, and that happened quickly, so the damage was minimal.
There have been reports of single center hospitals being able to achieve times as good as this, but really there's been no report of an entire population, in this case Alberta, having such great door-to-needle times. So we are currently the best stroke system in the world.